prosperity, and harmony. As the African Union champion for institutional reform, I am committed to asking the hard questions about how our continent can attract investment in social sectors like health. I am also dedicated to working with all of you to find the answers necessary for us to forge a new future. It is heartening to see partnerships emerge that promise to equip every African with an AI-powered digital health wallet, and each African country with the tools to attract the biopharma research and produce medicines, vaccines, and medical devices locally. Initiatives like Panabios, Proper, and Purpose Africa clinical research programs stand as a milestone in Africa's journey towards becoming a global innovation powerhouse. However, none of this can be sustained without rethinking how we fund these initiatives. Africa's rise depends on ensuring that our continent has access to capital that can build the healthcare infrastructure that we need. We have to be creative, we have to be innovative, and we have to work in collaboration. I want to recognize the efforts of AUDA in developing the program for investment and financing in Africa's health, commonly known as PIFA. Alongside AU agencies, Afro Champions, and Purpose Africa, PIFA is laying the groundwork for unlocking vast resources from the private sector. I commend the African Union's AUDA for laying the groundwork with a program for investment and financing in Africa's health sector. As this program advances, with the support of Afro Champions and Corporate Council for Africa and other partners, I assure you of my unwavering support, and I speak on behalf of many African heads of state. I believe my fellow African leaders share this commitment, and we will work together to unlock private sector resources to ensure that there is success in this 1.4 billion people that live in our continent, to have an organization that is accountable. And it is the reason why we are rethinking the Pan-African Parliament to provide more oversight over the African Union Commission. And it is the reason why we want to roll out the African Court of Justice to ensure that we can work within the parameters of law, ensuring that there is greater synergy in the organs of the African Union as we position Africa, whether it is at the G20, whether it is at the United Nations, to be able to play our rightful place and effectively represent and speak for the 1.4 billion people that live in the African continent. There cannot be a better place to figure out health, education, and social services than in Africa, where the median age is 19 and a half. That is the place where education means everything. That is the place where health means a lot. And that is the reason why what AUDA is doing is phenomenal. And I want to tell you, Madam Director, you have our support. With that, ladies and gentlemen, I am honored to formally launch the program for investment and financing in Africa's health, and wish all of us the very best. Thank you very much.
Asante sana Mheshimiwa Rais. We ran into each other actually outside of the hotel. I tell you, I couldn't keep up with him. It's the fastest walk I've seen in New York City. And even I had my running shoes on. Thank you, Mr. Rais, for accommodating on quite busy schedule here. And I was thinking, Mrs. Nardos Befele Thomas, if you can add if you would like to add a few more words and just articulate some of the key priorities that you're looking at. I know that you just briefly said hello in order to